All right, so welcome back to Nickels 2 Cents. Today we're going to talk about ketogenic diet. This is something that I do recommend quite often with my patients, and this was actually a scientific look on essentially how the keto diet works. So a ketogenic diet is primarily fat. So 70% fat, 20% protein, 10% carbs. And essentially, while you restrict carbs, that puts you into a metabolic shift where your body is now liberating stored fat for fuel. And when the body does that, breaking down fat within the cell produces ketones. And so that essentially is going to be broken down through the liver and be used in it's going to bring up into the brain, the heart, and the skeletal muscle, and that's going to help produce energy or ATP. Essentially, our ancestors, did get into ketosis because when there wasn't food available, the body had to use fuel from their fat cells for energy. So, they did a lot of intermittent fasting in the past, which is, what we recommend as well for patients. So essentially, with eating a high-fat diet, what that does is that benefits a lot of different things in the body. It helps to lower cardiovascular risk. It helps with increased energy. It helps with, brain food, food for the brain. And it helps with, weight loss. So I do a lot with berberine, which everybody knows is like my favorite supplement, which helps from a mechanistic standpoint in regards to insulin resistance. And then we do a ketogenic diet to help from a weight loss standpoint. And essentially, when you burn stored fat for fuel, it's more efficient fuel burning anyways. So, think about ketosis if you're having a hard time, losing weight. If there's any neurodegenerative issues in the family, doctors will actually prescribe a ketogenic type of diet for seizures, for, neurodegenerative issues. So when you think about, fat for the brain, think about a ketogenic diet. All right, have a nice weekend, everybody.